Hello guys, still on the overview of the muscles of the lower limb. We've talked about the glute, right? Let's now talk about the overview of the muscles of the thigh. This is overview. We're not started treating the muscles. This is overview of the muscles of the thigh region. Now, take note that the muscles of the thigh are divided into 3 compartments by a fascia. That fascia is called the deep fascia, and it is called the word fascia lata. So either you say deep fascia or you call it the fascia lata. Everybody, we said that the muscles of the thigh are divided into 3 compartments by the deep fascia. What the deep fascia also called fascia lata. The 3 compartments are what we call the anterior compartment, the medial compartment, and the posterior compartment. The anterior compartment are called the extensors. The medial compartment are called the adductors. AD dots. AD, not AB now. AD, we're going to talk about that. AD dots. And the dot is what we call the posterior compartment, which are also called the flexors. So look at it. Number 1, we say we have the anterior compartment, also called the extensors. Number 2, we have the medial compartment called the adductors. AD is different from AB. In AD, you are taking away. Look at it. In AB, you are taking away. In AD, you are adding. You are coming close. So the third is what to call your posterior compartment, or you call them your flexors. Everybody, what are the compartments of the thigh region? We said the anterior compartment, medial compartment, posterior compartment. But when we get to leg, there's nothing like medial compartment. We only have lateral. So leg, now we're going to have anterior, lateral, and posterior. But for thigh, since we're in thigh, we have anterior, medial, and posterior. Now let me also give you something now. Hold on a bit. A complete series of classes in anatomy, all of them, physiology, all the physiology, biochemistry, all, they are available in the LearnLift app. So just head down to Play Store or App Store and type LearnLift, right? And then download the app, and you have access to all your classes and the continuation of this lesson you are watching right now. For the now, peace out. This is a transcut of the thigh. So we give a transcut, a transection on the thigh. First, what you see, you're going to see the skin. After the skin, what the next, you're going to see the fat layer, be subcutaneous fascia or the superficial fascia, which is the yellow T you can see. This is what called the subcutaneous fascia, or the superficial fascia. That's the fat layer. After that, you see the green layer called the deep fascia. Now, the deep fascia of the lower of the thigh, everybody, what the deep fascia of the thigh called is called the fascia lata. When we get to the leg, the deep fascia of the leg is called the crural fascia. Know the difference. Deep fascia of the thigh is called the fascia lata, or that's the deep fascia. So the deep fascia is now going to divide this thigh into 3. So divide it now. Are you seeing that? The first, what we call the anterior compartment, also called the extensors, because they help to extend the knee joint. The second is what we call the posterior compartment, also called the flexors, because they help to flex the knee joint. Are you seeing that? And the third is what we call your medial compartment, also called the adductors of the joints. Are you feeling me? So everybody, these are the compartments of the thigh. So let's take some compartment one after the other. Let's start with the anterior compartment. We said the anterior compartment are also called the extensors. Now, everybody, what are the muscles of the anterior compartment? I call them the PSQ. Look at it, PSQ. The first P there, the P there is what we call the pectineus muscle. What I call it, pectineus muscle. S there is what we call the sartorius muscle. It's the longest muscle of the lower limb. It's also called the talus muscle. So if they ask you in the exam what is called the talus muscle, just shout to them sartorius, because we said it is believed that it is what makes talus to sit in that tailoring position, or those people that they sit in. If you watch, should I say Chinese movie, especially Chinese movie, and you see them sit, those monks, there's a way they sit, there's a way they do their thigh. That is done by the talus muscle, also called the sartorius muscle. So the first P there is what we call pectineus muscle. S there is what we call sartorius muscle. The Q there is what we call the quadriceps femoris. And the quadriceps femoris are divided into 4. We have the vastus lateralis, the vastus medialis, vastus intermedialis, and the rectus femoris. Bro, calm down. You go know all these things. I told you muscle choke, but you are going bit by bit. You go learn. Do you understand that? So let's see. And there's also another muscle too, which is called the iliacus muscle, which is formed by the iliacus and the psoas major. So let's list them. The first is P there is called the pectineus muscle. Are you seeing that? One pectineus muscle. S there is called the sartorius muscle. This is what we call the talus muscle. So sartorius muscle, also called the talus muscle. Talus muscle. So enter the exam mode, they see talus muscle, sartorius, and it is the longest muscle. Are you seeing that? Because it extends from the hip joints to the knee joint. It is the longest muscle longest muscle. So the sartorius muscle, and we have few there we discuss the word the quadriceps femoris. The quadriceps femoris are 4. We're going to talk about that. Why the 4th one is also called the word the iliopsoas muscle. This is formed by 2 muscles, iliacus and psoas major. Have you seen that? So iliacus and psoas major form the word iliopsoas muscle. Everybody, what are the anterior compartment? We said it's called the PSQY if you now add the iliopsoas, right? So the P there is called the pectineus muscle, L there is called the sartorius, also called the talus muscle, and we have the quadriceps femoris. These quadriceps femoris are now divided into 4 from the word quadri. Quadri means 4. Number 1, we have what to call the word the vastus lateralis. Are you seeing that? The vastus lateralis, we have what to call the word the vastus medialis. Then we have the vastus intermedialis, and we have the rectus femoris muscle. This is the muscle of the anterior compartment. Is it choking? Stop, everybody. What are they? We have the pectineus, sartorius, quadriceps femoris, iliopsoas muscle, and we said that the quadriceps femoris have 4. We have the vastus lateralis, the vastus medialis, the vastus intermedialis, and the rectus femoris. Now, I also want to tell you something. I told you at every point we're going to be increasing our knowledge bit by bit, even if we have no button there. Now, everything about the anterior compartment is femoral. What I say, everything about the anterior compartment is femoral. What's the blood supply? Femoral artery. What's the nerve supply? Femoral nerve. The vein too is what? Femoral vein. So everybody, what is the blood supply? Femoral artery, the nerve, femoral nerve, the vein. So everything about the thigh, femoral. Think femoral. Femur now from the word femoral. So femoral artery. I'm going to show you how it is the femoral artery. How the external iliac artery at the point of the inguinal ligament become the word femoral artery. We want to talk about this under the overview of the blood. So after muscles, we'll go to blood. So everybody, what are the anterior compartment? We have the pectineus, the sartorius muscle, the quadriceps femoris muscle, the iliopsoas muscle. And we said that the quadriceps has 4. We have the word the vastus lateralis, the vastus medialis, the vastus intermedialis, and the rectus femoris. Now listen to me. Time will not fail if I not say 2 things here. First, there is something different about the sartorius muscle and the iliopsoas muscle. Yes, the anterior muscles are called the extensors of the knee joint. What I call the extensors of the knee joint. Extensors of the knee joint. Not of the hip of the knee joint. Because all of them are moving towards the word, the knee joint. So they are extensors of the word of the knee joint. Now, but you see your sartorius muscle and iliopsoas are flexors of the hip joint. This is hip. So both of them are not. Now look at it. Normally we say the anterior compartment are extensors of the word of the knee joint. Extensors mean to increase the angle. Flexors means to decrease the angle. But among them, these 2 guys are different. Your sartorius muscle and your iliopsoas muscle. They are not. What they do is that they flex. What do they flex? They flex hip joint. Hope you know that the hip joint is above the word the knee joint. So they flex the hip joint. So they are flexors of hip joint, but the rest are what? Extensors of knee joint. Are you seeing that? That's the only exception. The anterior compartment muscle are called extensors, but which of them flex the hip joint? What should come to your mind? You should tell them your sartorius muscle and your iliopsoas. You're going to see that in past questions. Now let's go to image. Now looking at this image first, without even labeling, only me I can label this image. So let's label the image before the main labeling will come. Now this first one here, this muscle 1 is what we call your pectineus muscle. What I call it is the pectineus muscle. Are you seeing that? This muscle you see here is called the talus muscle, which is the longest muscle. This is the sartorius muscle. Are you seeing that? Now, the next thing to see there is what we call the word. We talk about the iliopsoas, right? This one is what we call the word the iliopsoas muscle. It consists of 2 muscles. The iliacus, you can see the midline like this. This line here consists of the word the iliacus and the word the psoas. It's called the iliopsoas muscle. Now let's talk about your quadriceps muscle. What are your quadriceps muscle? This one, let's call this is the vastus lateralis. You can see it's at the lateral side. This is the vastus medialis. This is the vastus intermedialis. So let's call it 6. This is the rectus femoris. Now these quadriceps muscles are connected to bone by this tendon. This tendon is called the quadriceps tendon. You can see it's quadriceps tendon. We're going to label that. Why? This muscle you see here, this muscle, let me call it number 8, is what we call the adductus longus. And this one is what we call the word the gracilis muscle. Do you understand that? Let's now label them properly. So labeling them properly now, the first, this is what we call the word the pectineus muscle. We'll talk about that. That's the pectineus muscle. The first one is what we call your sartorius muscle. We say it is the longest muscle and it is called the talus muscle. The third is what we call the vastus lateralis. That's the quadriceps muscles, right? The vastus lateralis. This is the vastus medialis. Now, this is the vastus intermedialis. Are you seeing their demarcations? And you can see this one is what we call the rectus femoris. So that's the rectus femoris. Now, which other muscles can you see? Don't forget that we have the iliopsoas. So this is called the iliopsoas muscle. This point is called the iliopsoas muscle. Have you seen that? So we have the iliopsoas muscle. These are the muscles of the anterior compartment, also called the extensor muscle. Don't forget, I call them the PSQ, the pectineus sartorius muscle, the quadriceps femoris, which is the vastus lateralis, vastus medialis, vastus intermedialis, and the rectus femoris. Now, there's always a constant past question here. Hope you know that. Well, I'm going to show you when we get there. So if you say you understand this quickly, let's now also discuss something. We said that these are the rectus femoris, this is the vastus lateralis, the vastus medialis, vastus intermedialis. You can see them now. The quadriceps muscles, these are the quadriceps muscles. They are attached to the patella. We said the patella is the largest sigmoid bone, right? It's a sigmoid bone. So constant past question, what's the largest sigmoid bone? You should know that's your patella. We said that all of them, the quadriceps muscles, are connected to the patella by a tendon. That tendon is called your quadriceps tendon. And this quadriceps tendon is going to continue beneath, inferior to the patella, as the patella ligament or the patella tendon. So on top the patella superior, this is the patella. Above it is called the quadriceps. Below it is called the patella tendon. Constant past question. I know why I'm striking that point. Now look at it. We said that the quadriceps femoris muscle are attached to the patella via a tendon. That tendon is what we call your quadriceps tendon. I went for that to say that the tendon continues as the patella ligaments, or you see the patella tendon. It continues as the patella ligament. Do you understand that? If you still understand that, let's try the first past question. The past question says fill the gap with the correct answer. The muscle that produce common cross-leg sitting position used by Taylor. Which muscle is that? It's called the talus muscle. And what is the talus muscle? That's the sartorius muscle. Did you get it? You know that I'll blow you. Now quickly, let's move another past question. We're told that filling the gap. Quadriceps femoris muscle is attached to the patella. What is attaching the quadriceps femoris muscle to the patella? We said it's called the quadriceps tendon, right? Which is going to continue as the patella ligament. So quadriceps tendon. Very quickly, when it comes to creating accounts, how do you create an account? Very easy. Let me give you the steps. First and foremost, you say create account and log in. You only log in, right, when you already have an account. Since you don't have an account, click on create account. When you get there, put in your phone number. After putting in your phone number, you click on continue, right? Your first name, of course, you put in your first name there. If your first name is James, you put in James as your first name. Your last name, if your last name is Victor, you put in what? Victor as your last name. Then you come to email address, right? Put in your email address there very quickly. James112 at gmail.com. Then your password, right? Oh yes. Those of you that if you want to use your name, your password can just be like 6 digits, right? Oh yes. So let me say James 12 as the password, right? Fill everything accurately and correctly. James 12. Don't jump any stage. If not, your account is not going to open for you. Select education. Under select education, of course, university. You click university. Leave secondary, primary, leave the others. Click university or tertiary. Click it. Come to select level. Under select level, you go and select your level. If it's 100 level, 200 level, of course, all these are the university classes. Click on 200 level and click on create account. Once you click on create account, what will happen? Your class will load straight and then your profile will be set up and then it will take you to class. Easy and direct. So you see it. This is how you create your account. And then from here, you can see that you have your anatomies here, your upper limb, your lower limb, separately embryology, histology, systemic anatomy. Those ones are for nursing. Your CVS, cardiovascular system, your blood physiology, excitable tissues, systemic physiology, intro to biochemistry, your biomolecules, BCM for nursing, nursing psychology. You have access to every single thing in the app. Now, let me see what is in the app. Let's say, for example, upper limb. You click on the upper limb, right? You can see that you have your classes there already waiting for you. Overview of the upper limb, pectoral region, arm region, forearm, hand,
all of them part by part. When I click on the overview of the upper limb, of course, I'll just match it straight to my class. Parts of the upper limb 1, parts of the upper limb 2, bones of the upper limb, joints of the upper limb, muscles. You see, all your classes are there for you, right? Okay, let me say I want to start now, and then I want to watch joints of the upper limb. All you just need to do is click on that particular class that you want to watch, joints of the upper limb, and what will happen? Your class will load, and your classes will start playing for you immediately. Shall you see? You may choose to say, okay, I want to rotate it, right? Oh yes, rotate it, and you start following your classes immediately, easy and direct. You may choose to say, okay, you want to forward, you want to pause, you want to back forward, anyone you want to do. And you take it forward, and what happened? You can see all of them very, very easy. And the sweet part is that there are questions for you at the end of every class. Are you with me? So that's for that. And you may choose to go back and then go to the notes section of the app. Oh yes, when you get to the notes section of the app, of course, the notes are there, well organized and arranged for you. And you can zoom in and then start following back to back, and you are following. You may even choose to go and start answering questions. Questions are there for you, and their answers. You start following through every singular facet of it, and you are learning on your own. And there is CPT in the app as well for you, a lot of other aspects that you can follow up. All of this in the LearnLift app. Same way you have for anatomy, that's how you have for physiology, that's how you have for biochemistry. Are you getting it now? For the now, bye-bye.
Now, if you say you understand that, let's label the diagram. Everybody, this is your classwork. Look at the diagram. Everybody, all eyes on the diagram. This is what make me to know that you understand the anterior muscle of the thigh. Everybody, what is the muscle label 1? Yes, did I hear from that guy? Who is saying, is that your vastus what? Medialis? God bless you, that boy, you are correct. That's what we call the word, the vastus what? Lateralis. So number 1, that's the vastus what? Lateralis. Give me one step, muscle number 2. Muscle number 2, don't think, tell me fast. I explain it in class. The muscle number 2 is called the what? The iliopsoas what muscle, correct. What about the muscle number 3? Is that the rectus femoris? Or your vastus intermedialis? Rectus femoris, that girl, you are very smart, correct. Now, what is the muscle label 4? That's the longest muscle, Abi, also called the tailor muscle. That boy, you was the answer. God bless you. Score the word, the sartorius muscle. Very correct, very correct. What was the muscle number 5? Yes, I'm waiting for you, I'm waiting for you. That guy on green. What was it? God bless you. It is called the word, the vastus what? Medialis. What was the muscle number 6? Muscle number 6. That's what? The vastus intermedialis. Correct, correct, correct. What was the muscle number 7? The muscle number 7, yes. That's the pectineus muscle, correct. I think that's all. Now, the other muscles here, you can see this 8. We say 8 is the adductor longus. We're not talking about that for now. Why this is called the word, the gracilis what muscle. Why this is called the tensor fasciae lata, right? Which is going to continue as the iliotibial tract. Do you understand? So, quickly, that's everything about muscles of the word anterior word compartment. So now, let's now talk about the medial compartment. The medial compartment are called adductors of the hip joint. What do you call them? Adductors of the hip joint. I have an acronym for them. I call them the GO BLM. GO BLM. The gracilis muscle, the obturator externus muscle, the adductor brevis, adductor longus, adductor magnus. What I call them? GO BLM, 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 GO BLM. Which we call the word, the gracilis, obturator externus, the adductors brevis, adductors longus, adductor magnus. Look at this. Number 1, gracilis muscle. Number 2, we have the word obturator what? Externus what? Muscle. And we said we have the word, the adductors, right? Under the adductors, there are three. We have what to call the word, the adductors brevis, we have the adductors longus, we have the adductors what? Magnus. I call them the GO BLM. Will you adopt my acronym? GO BLM, GO BLM, GO BLM, GO BLM, GO BLM, GO BLM. The gracilis muscle, obturator externus, adductors what? Muscle. Now, take note that everything about the medial compartment is obturator. The artery is the obturator artery, which is a branch from your internal iliac artery. The nerve is the obturator nerve, which is a branch from your lumbar plexus. Do you understand? So take note that we say blood supply obturator artery, nerve supply obturator nerve. Just the way we have the anterior compartment to be everything femoral. So everything about the medial compartment is called your word obturator. Everybody, what are the muscles of the medial compartment? We say we have the word, they are called the GO BLM, the gracilis muscle, obturator externus muscle, the adductors what? Magnus. Under the adductors, we have the adductor brevis, longus, and what? Magnus. Do you understand? Now, what are their functions? They are adductors of the word of the hip. Yeah. Look at the diagram. First of all, this is the gracilis muscle. You can see that, right? This is the adductors brevis. That the adductors longus. That the adductor what magnus. Can you see them? Brevis very small. You can see the adductor longus and you can see the adductor what magnus. Do you understand that? Now, these are the muscles of the what of the medial compartment. Let's see more. You can see this is the obturator what internus muscle. This is the adductor brevis. This is the adductor longus. This is the what adductor what magnus. Now, remember that this is overview of muscles. So we are going to talk about the origin and insertion when we get to what to thigh. But now we are focused on the what on the overview. Now, still on the medial compartment, we said that what are the functions of the medial compartment? We said they are the adductors of the what of the hip joints. Adductors of hip joints. Yeah, adductors of hip joints. What should come to your mind? They are called the what the medial compartment. Do you understand that? Let's now talk about the last compartment. Remember that we said that the thigh is divided into three regions by the deep fascia, right? The anterior compartment, the medial compartment, and the posterior compartment. Anterior compartment, the extensors, medial compartment, adductors, posterior compartment. They are called the what the flexors. They are called the what the flexors. So they are called the flexors. Now, first and foremost, what are the muscles of the posterior compartment? I have an acronym for them. I call them the BSS. Everybody, what I call them the BSS. You can see I have an acronym for everything. The BSS. BSS. We have the word the biceps femoris, semimembranosus, and semitendinosus. BSS. Bicep femoris, semimembranosus, semipendinosus. Now they are also going to form the upper border of your popliteal fossa. When we go to popliteal fossa, you should know. So what are the muscles of the posterior compartment? We said they are called the flexors, right? Number one, we said it was the BSS. The B there is called the bicep femoris, the semimembranosus, and semitendinosus. So number one is called the bicep femoris. Are you seeing that? Number two, we said we have the word semimembranosus, and we have the word semitendinosus. BSS, bicep femoris, semimembranosus, semitendinosus. Bicep femoris, semimembranosus, semitendinosus. Do you understand that? The question is now, what's now the blood supply? What's now the nerve supply? The first one is what we call the what the head of the what adductor what magnus. Now this is it. Adductor magnus on the normal is on the medial compartment, but the head, we call it the ischial head. The ischial head of adductor magnus extends into the posterior compartment. So that is why we said that the ischial head of the adductor magnus is part of the posterior compartment. So what do we say if you want to put them together? We say we have what BSS, and don't forget the ischial head of the adductor what magnus. Ischial head of the adductor magnus. So what's now the blood supply and nerve supply? The blood supply is the profunda femoral artery as well as the inferior gluteal artery. Inferior gluteal artery is coming from the gluteal region. So we're going to talk about this. The profunda femoral artery, the femoral artery, which is the artery of the thigh, gives a deep branch called the profunda. The word profunda in Greek means deep. Are you seeing that? The profunda femoral what artery, which is going to give rise to three branch. The lateral, the medial, and the perforating artery. We're going to talk about that. So what is now the nerve supply? The chief nerve supply of the posterior compartment of the thigh is sciatic nerve. What I call the sciatic nerve. This is where you escape from during what ingestion. We're going to talk about that. Everybody, what's the nerve supply? Sciatic nerve. Now, this nerve supply and blood supply that we have been listing may look strange to you. Just calm down. I'm going to do overview of blood, overview of nerve supply, so that you understand all these things. Everybody, what are the ones of the posterior compartment? BSS and the ischial head of your what adductors what magnus. Now, look at the diagram. First, that's the glute. You can see this is the gluteus maximus, right? So let's label that. The first thing you can see is the what the bicep what femoris. This is the bicep femoris. Now, this one, the long one, this one is called the semimembranosus. Why? This one that has a tendon is called the semitendinosus. So this first guy is called the semimembranosus, while this one that has a long tendon is called the semitendinosus. Everybody, what are the muscles? We say we have the BSS, right? We also talk about that the ischial head of adductor magnus is part of it, but we said that it's just part of it, but the major muscles are the what? The BSS. Do you understand that? Let's also see another diagram to explain that. From this diagram, you can see this is the bicep femoris muscle. You can see the semitendinosus. You can also see the what semimembranosus. All of them form the posterior compartment. We also went further to say something. What are the posterior compartment muscles called? They are called the what? The hamstring muscles. Do you remember that? Posterior compartment is called hamstring, right? While the posterior compartment of thigh is called hamstring. While posterior compartment of leg is called calf muscles. Do you understand that? So we're still going to talk about that. Posterior compartment of your thigh is called your what? Your hamstring. If you say you understand it, let's summarize everything about the thigh. We said the thigh has three regions, right? Let's summarize the blood supply. What's the blood supply and nerve supply of anterior compartment? This is the anterior compartment. What's the blood and nerve supply? We say femoral artery, femoral nerve. So femoral artery for blood supply, as well as femoral vein, while for nerve, femoral nerve. Now, what about for your? Now, give me for your media. Media, we say we have the obturator artery, and we have the what obturator nerve. While for your posterior, we have the profundi femoral artery. We also have the profundi femoral artery. We talk about the inferior gluteal artery. While for the nerve, we talk about the sciatic nerve. So for me, for lateral obturator artery, obturator nerve. For posterior, we have the profundi and the inferior gluteal artery, and also have the sciatic nerve. Do you understand? This is the summary for your glute, for your thigh. Now let's not talk about it. Let's see one or two past questions. Right T for true, F for incorrect. The question says that iliopsoas, please follow the question. Iliopsoas and sartorius muscle allow extension for hip joint. Is that statement correct? First of all, iliopsoas and sartorius, what are they? We said they are anterior compartment. Anterior compartment muscles are called extensors, but two are exceptions. Iliopsoas and sartorius, right? Iliopsoas and sartorius, what do? We said that they help to flex the hip joints. They help to flex the hip joint. But this question is saying extension. Did they extend the hip joint? No, they help to flex the hip joint. So this statement is very, very correct. So it is false. Are you seeing that? Anterior compartment are extensors. Where are they extending? What are they extending? They are extending knee joint. Not what? Hip joint. Do you understand that? So let's see another past question. The past question says that right T for truth and F for incorrect. The question says that semimembranosus and sartorius muscles produce flexion of the knee joint. Now, flexion is by whom? They are talking about knee joint, not hip. Knee joints. Now, we said that normally anterior compartments are extensors of the knee joint. Posterior compartments are flexors of the knee joint, while your lateral compartments are the adductors of the hip joint. Is that correct? Now look at it. The semimembranosus is it an anterior muscle or a posterior muscle? It's a posterior muscle of the thigh. It's an hamstring muscle, right? So it's actually for what? For flexion, right? But sartorius is flexion. But what does sartorius flex? Sartorius help to flex what? The hip joint, not the knee joint. Semimembranosus flex knee joint. Yes. So this is correct. This is correct, but this is wrong. So making the statement to be false. Semimembranosus are flexors of the knee joint, but sartorius, they are flexors. So, but despite they are in the anterior compartment, but we say they are flexors of the what? Of the hip. So this is false. Do you understand that? Let's see muscles of the what? Of the leg. We'll talk about muscles of the leg in our next class. I hope you understand muscles of the what? Of the thigh. Hope you can quote the anterior muscles. Anterior muscles PSQ. Medial muscles go BLN. Posterior muscles BSS. I hope you understand that. I'll see you in the next class, but for now, peace out. Hope you've enjoyed this class. Guess what? To follow up for more classes, just download the LearnLift app, whether on Play Store or App Store, and then follow up your classes. You must do extremely well. I'll see you in class. Bye-bye.